live from the WIDU Community Room.
The WIDU Radio Network. WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making rounds live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making rounds live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Now, before we bring in our next guest,
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the
They offer that at Cape Fear Valley Health for cancer patients, and they meet every Wednesday from 3 until 4:30 in the Cape Fear Valley Cancer Treatment and Cyberknife Center over on Owen Drive. And if you want to know more information, you can call 910-615-4626. And art therapy for the cancer patients, they do amazing things over there because you already know I have personal experience in dealing with them over there. So, ladies and gentlemen, please join me in welcoming our next guest, Dr. Zyla Horgan. Dr. Horgan, she is a medical resident, and she has a strong passion for women's health and community education. And if you could have seen this young lady behind the scenes during the commercial break, you would see firsthand what I mean by passion. Today, she is here to help us understand something that I had to deal with once upon a time: fibroids. And that is a condition that affects so many women, especially African American women, and it often goes undiscussed and undiagnosed. So, Dr. Horgan, thank you so much for coming to Cape Fear Valley Health's Making Rounds Live. Welcome to the broadcast.
Well, thank you so much for having me.
Now, before we get started, who is Dr. Horgan, and what made you come to Cape Fear Valley?
Yeah. I'm Zyla, like a xylophone. I never knew I wanted to be a doctor, but grew up in a low health literacy family, so we didn't really go to the doctor or talk about medicine or anything like that. And I just saw gaps in that. I knew I wanted to do something that ended me up in medicine. And when I applied for residency, I ended up here at Cape Fear Valley. The system about how we get into medicine is a little wonky, so the Lord put me here in Fayetteville, and I really, really have enjoyed it. This is a community that has such a rich culture and so many just really kind, amazing people, but also a lot of health needs. So working over at Cape Fear has been an amazing opportunity for me, and I love it here.
Well, welcome. Thank you so much for being here. So, Dr. Horgan, for our listeners who may not know, could you explain what fibroids are?
Mm-hmm. So fibroids are something that affect your uterus, so only in women. It's a overgrowth of your muscle cells, basically in the uterus. So your uterus is a muscle. And so some of those cells can become overgrown and create a mass. It is not cancer, so benign is what we say. It is not a aggressive cancer or anything like that. But just an overgrowth of those cells, and in some women it can be unnoticed and not cause any issues, and in a lot of women it can have a lot of negative side effects.
Now, how common are they? Because I know, like I said earlier, I suffered from them. And Dr. Horgan, they were brutal. They would stop. I would walk, and they would just stop me in my tracks. I would fall on the floor. I would curl up in a fetal position. The pain was excruciating, and I won't share all of the other details because I don't want to gross the male listeners out. So, how common are they, and what typically causes them to develop?
Yeah, that's a good question. So fibroids are very common. In some studies, they say up to like 70% of women can be affected by them. It's usually around like 40-ish%, but there are certain populations that are more prone to having fibroids. Some of those things would be a family history of them. So if you knew that your mom had fibroids or your grandma, it is more likely that you might suffer from them. Some other things I'll probably talk about a little bit later can also cause them, but the actual like scientific cause is not super well understood. They think that sometimes when you're like actually like in utero still, so before you're born, when all of your cells are making you, some of those cells get misplaced basically, and it can be something that you're just born with and you're kind of like predisposed basically, so you're more likely to have it. And it's just like that increased growth of the muscle cells of your uterus.
Dr. Zyla, Dr. Horgan, you mentioned family history, and I'm glad you mentioned family history because, first of all, I didn't know that you could have a family history of fibroids. It's something I've learned today. So, how important is knowing our family history?
Yeah, I think it's very important, arguably, especially us as being women. A lot of the issues that we face sometimes are familial. So if you've had a history of miscarriages or your mom had a history of miscarriages, sometimes that can link us to think about other things that could be going on that maybe, you know, your mom or your grandma never knew about, and it can help us maybe help you as the patient. When thinking about something like fibroids, if you know that your mom dealt with them, I think it just helps you be a little bit more aware about if you're having symptoms of really heavy menstrual cycles or feeling bloated all the time or pain all the time in your pelvic area. It kind of just will help you identify, hey, like maybe this could be something that's going on with me too.
Ladies and gentlemen, we're talking to Dr. Zyla Horgan. Dr. Horgan is a medical resident at Cape Fear Valley Health, and we're discussing something many people don't want to talk about, and that's fibroids. And if you want to be part of the conversation, you can do so. You can call the studio at 910-483-6111. Again, 910-483-6111. Or if you're following us by way of Cape Fear Valley's Facebook page or social media, you can ask the questions in the comment section. Lindsay is there. She'll make sure that we get those questions answered for you while we have the experts here. Finally, make sure you share this information, especially now with what we're talking about. And remember what I said at the beginning of the broadcast. Because of what we're talking about now, remember this is for informational purposes only. This is not a time for you to self-diagnose. So if you suffer from fibroids, find yourself a healthcare professional. And with us in the studio is Dr. Zyla Morgan, Dr. Zyla Horgan, excuse me. Dr. Horgan, other than pain, excruciating pain, what are some of the symptoms that we need to be aware of when we're dealing with fibroids?
Yeah, that's a great question. And I think it's helpful that you've, you've experienced this too, so you kind of know what it's like. But a lot of women, it's not something that's often talked about, or if you grew up in a household that didn't really talk about things like that, you might not really know and just think this is normal for you. But some of symptoms that you can have if you're suffering from fibroids are feeling like a lot of fullness, kind of like what many women feel on their period sometimes, of like intermittent bloating. So it's just kind of bloating that comes and goes. But women with fibroids, the fibroid is always there, right? And some women will have an increase like in the growth, so it will continue to get larger. So worsening of kind of like a fullness or a bloating, a lot of menstrual pain, but you're having it all the time, not just when you're on your period. It can cause you to have a lot heavier periods. So heavier periods are like medically defined as having more than 5 to 6 days of like really heavy bleeding. So that's like you have to, change your pad or tampon every hour or something for a few days, and it just doesn't seem normal. You could also be anemic from this. It can cause a lot of other issues. Bleeding and pain are a lot of the common side effects. You can also have some issues with constipation or feeling like you need to like urinate, but like that you can't, because sometimes that fibroid can cause like a change in the structure of your uterus, and it can affect your bladder and other issues. You can have pain with intercourse. There's a lot of, like a myriad of things basically that you can experience if you have fibroids.
I just went down the checklist with you. That's exactly what I did. Now, one thing that I had experienced, Dr. Horgan, was when I was going through, when I had the fibroids and I was battling the fibroids, a lot of folks would say it's in your mind. There's nothing really going on with you. It's part of the process. It's part of being a woman. So, can fibroids go unnoticed because of that type of thinking?
They most certainly can. And like many issues in women's health, a lot of issues, not just fibroids, but endometriosis is another great topic, or things like that. They affect things that affect your period and will kind of amplify these symptoms that a lot of women face every month. Can get labeled as quote unquote normal because, oh, this is just part of your cycle, or you're making this up, or, you aren't really in pain. I think somebody telling you that you're not in pain is very difficult to hear because you know how you feel. Somebody else doesn't know how you feel. So I think that is just a super important thing for us as women to advocate for each other. That's why I'm very passionate about women's health and wanting to go into OBGYN. Women go through a lot, and it's literally amazing that women can have babies and, have this miracle of life, basically. But we also go through a lot of negative things, and I think having like that stigma of, oh, well, this is just in your head, there's nothing wrong with you, it can be very hurtful for women to, be less motivated to talk to their doctors about it. They just kind of settle and say, oh, well, this pain is normal. I just feel pain all the time, or I have heavy periods all the time, and that's just how it is. I think there are things that can be done about it, and even just like the awareness of it can help a lot. So I think just really helping that stigma go away and just advocating for ourselves and advocating for other women.
Dr. Horgan, how are fibroids usually diagnosed?
Yeah. So fibroids generally are diagnosed by an ultrasound. Will be kind of the first thing that's going on. If you come to your OBGYN, your primary care doctor, and you say, I'm having really heavy periods, or I have a lot of pain. Sometimes if you have very large fibroids, you can feel them like in your belly. And especially if you're a small person, like they are very feelable, I guess. And if you've never had a baby, but it could be like you feel pregnant, kind of. They can be that large. So when you would go to your doctor, usually the first thing they do, besides a physical exam, sometimes they can be seen if you have like a pelvic exam, like a speculum exam. But often it's going to be ultrasound. So often they'll order an ultrasound of your uterus, and this gives us a good picture about where the fibroid is, because fibroids can be like outside of your uterus, they can be inside, they can affect different parts of it, and it gives us kind of just a better picture. And then from there are other things like MRIs and CT scans are usually not very common for looking for fibroids, but in my experience working in the hospital, it's a lot of the times incidental findings. So these are findings that you weren't looking for, but you just found. I've had a couple women in the hospital that we've been just doing studies for other things, and we found out they have a fibroid, and then we've been able to say, hey, you can follow up with your GYN doctor and talk to them about this. But usually ultrasound is kind of the first way that you're going to go.
Ladies and gentlemen, Dr. Zyla Horgan, she's one of our guests today. Dr. Horgan is a medical resident at Cape Fear Valley Health, and we're discussing fibroids. Today, something many folks don't want to talk about, but it's something that we need to talk about, and that's the reason why we're having this topic today. Now, Dr. Horgan, do fibroids tend to develop earlier and grow larger in African American women compared to other groups?
Yes, so there is a lot of research to say that fibroids disproportionately, meaning that they are not proportionate between races. So there is a lot of research showing that African American women and even like non-white people, so Hispanic, other cultures, struggle with fibroids a lot more. Some of this is attributed to some social factors. So as I said, fibroids we don't have a really great understanding, but some things that can contribute are high blood pressure. So high blood pressure has been one thing to show that it may be contributing to formation of fibroids. And then also a lot of external stressors in life, socioeconomic troubles, financial troubles, social things going on. And statistically, a lot of African American people have a lot of social stressors. Everybody does, but it a lot of the time disproportionately affects African American women, and some of these things can be contributing to why we see African Americans that have a lot larger fibroids sometimes and don't have a lot more symptoms. Some women can have fibroids and have no idea that they have them. They're completely asymptomatic because they don't bother them. But those ones that do have symptoms are much more often African American.
Dr. Horgan, can the healthcare system itself do a better job of supporting women who are dealing with fibroids or other reproductive health concerns?
Yes, we definitely can. I think a lot of that starts with patient education, is really just helping patients understand what is going on with their bodies, and also normalizing it, having those conversations with patients. Especially, that's why I encourage all women to talk to your family doctor or your GYN doctor. We talk about these things all day, and like you've mentioned, people don't really like to talk about periods and fibroids and all of these things, but I love talking about them. Literally, this is our jobs. We talk about these things every day. And so just being open with your patients and asking those questions. Are you having heavy periods? Are you concerned about your periods? Are you having issues like that you want to talk about? Sometimes just asking that question will lead a patient to open more and share. I think as a community also, we can just, create more opportunities. As we kind of talked about earlier, there's not enough doctors in this area, like there's not enough doctors in a lot of areas in the U.S., but just creating that access for patients. And I believe, Fayetteville is doing a really good job of that, of having more clinics that are just GYN focused, so just the gynecology part of it, to help women have access to be able to get into those appointments, and just know their bodies more and get the help that they need.
What would you say to women who may grow up in families who, we're not going to talk about this in this household? What do you say to them?
Yeah. I think that, knowledge is power. I think talking about things is really important. I kind of grew up in a house where we just didn't talk a lot in general. And so I think for me, what helped was having friends or a community around me that I knew I could talk to people about. So I think it really starts with you and, being that change and saying, I want to learn more about this, or this is something that I want to talk about, or I don't want to be silent about. It's nothing to be shameful about. Having your period is completely normal, and that's what allows women to have babies. It is just part of us as being women, which is very difficult, but it is a privilege. And so I think just really starting with you and starting to change that stigma with you and your community, and talking about issues that you face or things that you're going through. And what I've seen often, especially in my own life, is saying, hey, I struggle with this, is when a couple of your other friends in your circle might also say, hey, I have too, and we've never talked about this, but I didn't want to say anything because I didn't want to be the one to say I was struggling with this.
Ladies and gentlemen, Dr. Zyla Horgan on Cape Fear Valley Health's Making Rounds Live today. We're talking about fibroids, and we need to talk about fibroids. We need to get educated on this topic. Now, Dr. Horgan, once a woman is diagnosed with fibroids, what are some of the treatment options that are available?
Yeah. So as I mentioned, some women may have fibroids that don't impact them at all. They have normal periods. They don't have pain. They're able to become pregnant without any issues. But a lot of women do have a lot of pelvic pain, a lot of heavy periods. And so kind of the first line that we're looking at is birth control, basically, so with hormones. Fibroids are most common in women aged 50 or 30 to 40. And it's thought that the estrogen and progesterone in our bodies when we're of like reproductive age, so basically after we go through puberty, helps the fibroids grow. And so it's more common in these in these age groups. And usually in menopause, fibroids will start to shrink because they don't have those hormones feeding them, is the thought. So hormone therapy can actually help sometimes, usually with the bleeding. So not that it's necessarily helping the fibroid itself, but for women that have really heavy periods, something like an IUD, which is an intrauterine device. It's a long-lasting type of birth control. It is a little, I wish I had a little thing, but it's a little T-shaped device that goes into your uterus, and it is a contraceptive, so it protects against pregnancy. But also, what a lot of contraceptives are used for is for heavy periods. So it can help you decrease the amount of bleeding that you're having every month, and that can help you feel better overall. You know, if you're suffering from anemia or, you know, just fatigue all the time, that can help a lot. Some other options are medications that basically are putting you into menopause, so they're decreasing your hormone levels, and that is thought to help the fibroid not grow as much. A lot of women can have a decrease in the size of fibroids when they're on these types of medications, but unfortunately, because they are basically putting you into menopause, they have a lot of not fun side effects as far as, you know, hot flashes and fatigue and sometimes weight gain and things like that. So not a lot of great options in that aspect. Surgery is also always an option. They're called myomectomies when you can surgically have a fibroid removed. This is an option for a lot of women. For some people, though, the fibroids will grow back. So it can be helpful for some women, but it is not a definitive treatment.
Let's talk about new technology and research on the horizon. Is there anything out there that's improving fibroids or as far as treatments and management?
Yes, so doing research preparing for this, I learned that our friends up north at Duke, not far away, have a couple researchers who are doing some really cool things. They are using a collagen, which is a type of protein basically. So collagen is in our bones, it's in our skin. A lot of us women especially know we put collagen on our face and in our hair and all of these things. It is also in our muscles, and so they're doing research, injecting a type of collagen into the uterus to help decrease the size of the growth of fibroids. They've been doing this research for a long time. These three scientists have mostly always done fibroid research their entire lives. And so they recently had some participants in like a small clinical study, but it looks like it's really show some promise, which is really amazing. One thing that they did talk about in like this article that I was looking up was the fact that we don't have a lot of new information or like research or treatments for fibroids. I think is because a lot of what we've been talking about today is that it's something that affects women, and it causes often a lot of pelvic pain, a lot of heavy bleeding, things that women go through anyway. And I think it's sometimes difficult to get funding for that because there's not as much of a emphasis on that this is an important thing. But having fibroids can really affect your entire life. There's a lot of research to say that, you know, women who suffer from fibroids have a lot of, you know, more social difficulties of just as far as like constantly being in pain and having a lot of mental issues from that. As well as the other health aspects that it can affect. So I think it's just really important to, you know, advocate for ourselves and advocate for those that we love who are suffering from these things, to promote research and more things out there to help women.
Well, ladies and gentlemen, Dr. Zyla Horgan with us today on Cape Fear Valley Health's Making Rounds Live. And Dr. Horgan, since we're into the final couple of minutes of our broadcast, if someone wants to get more information, maybe they want to schedule an appointment, where should they go?
Yeah. So Cape Fear Valley website, so if you go to capefearvalley.com, or if you look up gynecologist Cape Fear Valley, you will find the clinics on the website. There are multiple clinics here in Fayetteville, in Bladen County, all around here. And also, it's very exciting. So going on there, you'll be able to find the information to the clinics, call them and make an appointment. There are also some physicians who have come to the area who are only doing GYN. So they are OBGYN doctors who their specialty is to focus on GYN, things like this. So fibroids, endometriosis, painful periods, menopause, things like that. That's all that they're seeing in clinics. So they're opening up more time to see women who are facing issues like this, which is very exciting. So all that information can be found on the website.
Ladies and gentlemen, Dr. Zyla Horgan. She is a resident physician at Cape Fear Valley Health. And Dr. Horgan, thank you so much for taking time out of your schedule to come and talk to us about fibroids. I know it's something that a lot of folks don't want to hear about, but we need to know this information. So thank you so much.
Oh, thank you so much for having me.
And ladies and gentlemen, also please join me in thanking Dr. Hershey Bell, the Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. We receive firsthand updates about the medical school. So once again, our next broadcast is Tuesday, November 4th, so make plans to join us. For our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live.